Here at Minnesota Eye Consultants, we have multiple new technology that helps us get a lot of information about each individual patient. When you come in, you can expect to be seen by a technician who will do several tests that help the doctor better understand how to devise the most appropriate treatment regimen for you. Part of the test includes looking at the inflammation on the tear film, so we can actually get a sense of how much inflammation is there on the tear film. That's absolutely critical in treating dysfunction of the tear film, because the more inflammation we have retained on the surface of the eye, the more dysfunction of the tear film that typically persists in the patient. So that's one of the main tests that we'll do. The other test that we'll do is measuring the thickness of the lipid layer. So you can expect to have these two tests done before you see the doctor, and then have the treatment done.
Evaporative dry eye actually presents with a variety of symptoms, and the hard part about diagnosing this condition is that, especially early on in milder forms, there's a whole host of symptoms that may present that you might not associate with dry eye at all. Things like blurry vision, especially while reading or computer work, are two key early symptoms that we see very frequently in our patients. Oftentimes, as the disease progresses, there's more symptoms that are related to discomfort, like grittiness, sandiness, or even things like watering if you step outside on a windy day. Those are all very common symptoms that we see in our practice that are from our dry eye patients. In more advanced cases, that discomfort becomes a lot more prevalent and begins to affect the quality of life on a more regular basis. In advanced cases, we see patients that have reduced quality of life, 24 hours a day, because they're constantly needing to put in drops to feel better and get some relief. So what one can expect from a patient perspective is that the visit's set up in two sections, essentially. The evaluation portion, where we're going to bring you in. We've got several different tests that analyze the quality of the tears, the lipid layer thickness, and we do a meibomian gland function assessment in the office, as well as some questionnaires. If you meet the qualifying standards to receive the LipiFlow treatment, then we'll bring you back into a room that's specifically designated for a LipiFlow device. We'll have you sit in a regular exam chair. You can sit back and relax. We'll numb up the eye with one drop of anesthetic, and then insert the device, which goes over the eyeball and underneath the lids. Once the machine and the treatment commences, the lid is warmed gently. It doesn't get uncomfortably warm. It's rather pleasant. And then once that's done for about 3 or 4 minutes, then the air bladders fill and the lids are massaged from the device, and that goes through several minutes of treatment. The device goes through 2 cycles for a total of 12 minutes.
LipiFlow treatment is more advantageous than some of the other treatments that target the glands along the eyelid, mainly because of how superficial the glands are themselves. So we take advantage of this when we're looking at the progression of the disease state. We can actually highlight the glands by just putting a light underneath the eyelid. And so that's how superficial these glands are. And LipiFlow really takes advantage of that. When we're doing the warm compresses at home, we will typically have to go through this much tissue to get to the affected area, which is here. This is the meibomian gland that houses the lipids. And so with the treatment, this device actually, the heating element of the device sits right underneath the inside aspect of the lid. And so it gets a much more focal treatment than other treatments that we're able to offer.
So the reason that the LipiFlow device exists is that a good percentage of patients who have dry eye symptoms, it's as a result of evaporative loss or a decrease in their lipid layer thickness. This comes from a dysfunction of a gland in the eyelids called the meibomian glands. These secrete a product that actually helps stabilize the tear film. So in treating these glands specifically, what we hope to do is increase the volume of lipid and the quality of lipid that's produced, thereby stabilizing the tears and increasing patient comfort and reducing symptoms of dry eye.
Each treatment takes about 12 minutes. And so we usually will treat both eyes at the same time. Patient comes in and we'll kind of recline the seat a little bit, make the patient very comfortable. and apply the device on each side, and the treatment starts right away. As soon as we put the device on the eye, the process begins. So the warm compress, the heating of the lid, and the massaging of the lid starts, and 12 minutes later, the treatment part of the visit is finished. After the treatment, we'll want to look in at the eyelid right after the treatment to once again assess the glands that line the eyelid.
Most patients will experience maybe a little bit of discomfort upon inserting the device underneath the lids, especially if you have a very small interpalpebral fissure or lid. But once the treatment commences, we've had no patients that have complained about pain. In fact, most patients kind of express the fact that they feel like they're maybe at a spa because of the heating and the soothing effect that it has on the lid tissue.
My experience with LipiFlow has been very positive. I'm very careful to choose the right patient to undergo the treatment. As we mentioned before in some of the other questions, some patients just won't benefit from the treatment. But if we choose the right disease, the point in the disease state, to incorporate the treatment, patients can really benefit from it. One of my patients, for example, drove in from 3 hours away and had been on many years of multiple treatments and really suffered quite a bit. After having LipiFlow treatment, exactly 4 weeks after the treatment was when he realized the biggest benefit of having undergone the treatment. He really called back and was very excited and happy about the dissipation of many of his symptoms. In fact, he's returned again, and not many of the patients that we treat will end up needing retreatments, but he's certainly one that benefited from LipiFlow for 6 months and has been now retreated 6 months after the initial treatment.
So my experience with it is actually quite positive. We've had a number of patients that we've run through at our clinic at varying stages of follow-up, as long as 6 months now. And the majority of patients do notice some improvement in the quality of their symptoms. Okay.
The clinical studies that looked at the long-term impact of LipiFlow treatment uncovered an improvement in symptoms for approximately 9 months to 1 year. And our results here at Minnesota Eye Consultants have been very positive early on, and the decision to retreat might be evaluated approximately 9 to 12 months after the initial treatment.
Because of the chronic nature of the disease and the fact that this is one more tool that we can use to help control meibomian gland dysfunction, I'm advising my patients to continue doing warm compress therapy and other types of pharmaceutical treatments at home. This is mostly to try to see if we can really get ahead of the disease and obtain a very desirable outcome. It may be advisable at some point to be able to discontinue those treatments, especially if the symptoms are greatly reduced. But for the time being, in the short term after the treatment's done, I'm having all of my patients continue treatment. So potential risks of this procedure are actually quite small. The procedure itself carries with it a potential risk of corneal abrasion. We've had potentially some swelling in the eyelids afterwards as well, which is very short-lived. No bruising, no patient complaints about ongoing pain or discomfort symptoms. So with the procedure itself, it's quite small. Ongoing potential risks, I suppose the biggest one is that we don't achieve the desired outcome in terms of reducing the amount of symptoms a patient will experience. Some of our patients may want to go through a second treatment as well, although that number for us so far has been quite small.